Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
No. Unstable angina. In unstable angina, the patient develops chest discomfort, and this chest discomfort, which is developed in the patient, is actually severe in unstable angina, and it should have one out of the following three features. So, the chest discomfort should occur at rest, and it should last for more than 10 minutes, and it should be of recent onset, that is, it should be at least the onset should be within the last 2 weeks, and it occurs mainly as a crescendo pattern. That is, this chest discomfort can be more severe, and it is more prolonged, and it is also frequent. It is severe, prolonged, and frequent than the previous episodes. So, if one out of the three features are present, that is, if it occurs at rest, and if it um, lasts for more than 10 minutes, or if it is in recent onset, or if the pain is more severe and prolonged and frequent, then it is unstable angina. In some patients, unstable angina can occur without any increase in myocardial oxygen demand, or it can occur in some patients due to coronary thrombosis.
thank you and thank you for watching.